by my top ministry officials led by the PS, the governor was also in attendance. Governor Nyagarama assured the residents of his county the readiness in combating the COVID-19 pandemic. He went on to enumerate what his county government had done to battle the disease, and may his soul rest in peace. The governor was a personal friend and an important person in the cooperation between county governments and the national government in matters health. Consequently, I would very much request you to remain upstanding so that we can honor this great leader by observing just 1 minute silence. Asanteni sana. I thank you. Distinguished guests, ladies and gentlemen, fellow Kenyans, it gives me great pleasure to preside over the official opening of the Santa Mo Specialized Surgical Hospital here in Murang'a County. I am pleased to note that this hospital will be focusing on orthopedic, general surgery, spine surgery, eye, nose, and throat, as well as maternity. This is a good case of private sector identifying an opportunity and running with it. I congratulate you. For a long time, this county, and indeed most of the Mount Kenya region, has had numerous deaths arising from traumatic road accidents and other causes requiring surgical procedures. Indeed, death by accidents has even been a subject of popular folklore and music by artists of this region. I am reminded of DK Daniel Kamau's song, Ikuishia Metoka, in which he sings of the loss of a loved one not too far from here, just down the road at Karigoini. DK comes from Gatanga, not too far from here, and knows the bad situation of this section of the Murang'a Road. He composed the song to express what many in this region expressed then and continue to face even today. Not too long ago, my home county lost a great leader from another road accident not too far from here. We know that many who die or become paralyzed because of injuries sustained from tragic accidents would not suffer the pain of losing life from consequences had they received immediate emergency care. And I believe that is why the chairman and the directors decided to locate this hospital where it is. Incidentally, it was yet another son of this great county, John Dishu, who sang a song on the difficulties of childbirth in his hit song, The Inawa Johnny wa Dishu. Although the circumstances describing the song have nothing to do with this county, he captured a concern of many a couple who seek maternity services under difficult circumstances. In most instances, when that hour comes, one needs services that are accessible and affordable. This is why hospitals such as this one we are opening today are important in our healthcare system. Private facilities complement our public facilities, and they are important in our overall health ecosystem. As I do so, as I congratulate you, the 5 directors who have put up this facility, with the vision of providing quality and affordable maternity and surgical services, I also urge you, like my dear sister, Mama County has said, that to remember that matters health are only secondarily matters profit, that the primary requirement is for you to have care, to have empathy. I keep saying that there are some professions that are calling, and one of them is the medical profession. You have to be called to be a medical doctor or a nurse or a clinical officer to be able to serve people the way that I know you will serve them in this institution. As private providers, you play a very critical role in healthcare services at both county and national levels. And it is gratifying to note that you are setting up this facility at a time when we are battling COVID-19 pandemic, a disease that has had tremendous impact on our lives. Businesses have particularly suffered greatly. I wish to appreciate your confidence in the healthcare system to put in your investment that you have done as much as you have recognized the challenges of the business environment. As I recognize you and I appreciate this effort, may I also appreciate the many healthcare workers who, despite the call to stay at home, quote unquote, are in the front line to save the lives of Kenyans and others, putting their lives at risk. This we do not take for granted. I take this opportunity to state that we have done and we will continue to do all that concerns our health workers. We have done a lot, and we will continue to work in ensuring that the doctors, the healthcare workers are served well also as they serve other people. I also want at this juncture to seek and to appeal to the directors of this hospital. Do not be satisfied with the current affairs of the situation of hospitals in our nation. You must raise the standards, and your standards must not be those of Kenya. They must not be those of the region. I urge you to set global standards of healthcare. And the reason why this is so important is because as we, as a nation, plan to promote medical tourism in our nation, the standards that will be required for that purpose will be very high standards. And I urge you to raise those standards to a global level. Secondly, the other issue, niko sawa. Sasa unajifisha na hapo waliniambia nitoke. So I want Dr. Shege and the other doctors who are here to please develop a paradigm shift in healthcare. Why do people go to India? People go to India because it is cheaper. Therefore, keep the cost down. Dr. Shege, mimi ningewasihi wewe na madaktari wale wengine, hapana fikiria mambo ya plot wakati unaangalia patient. Hapa imutiganeme na maundu ma kugura plot. Mwabe mutidekane na maundu ma guthondeka andu. Tondu uguo niguo mwiririirie. That is number one. Number two, kuri andu marioka ha kuma ha keno. Na marioka mari arwaru, na aturona ha, na murona mari kuria matukaine. Marioka mari arwaru, na rimwe matiri na besha. Ihoya riakwa na genyihia muno hari inywe ndagitari ni ati mwene nduko iri agigoka akorwo ndari na besha muthondeke ni ari kurehagira gacukari na kamutu ari o haria no muthondeke mucirage ucio ungi ari mwega tondu akiri wage kiguna naki kana mukugate andu akeno ithe tiguo wega no ningeti ati we tondu no ukite kuriha woka ningi ukahinyiriria ndagitari ukauga ndukuriha na ni wewe na bia modo kwaje mundu agoka na NHIF na NHIF leo ni gucenjia ona ndukuniri goka na kadi ukunidio kiara tu watu weka registered. And you know, Mama County, we are registering people, the poorest people in each county. We are registering for free. The government is paying for them. So we should be on the forefront of registering as many people as possible. It's free for those people who are unable to pay. Turamarihira each person 6,000 shillings so that they can be enrolled in NHIF. So that when they come here, then they are able to pay, and Dr. Shege and his group can able to invest more in more equipment, in more care facilities, and therefore you can get global standards. But I also want to urge you, as we had spoken earlier, to adopt a new approach to healthcare, because diagnosis is the biggest challenge that we have in the country. So that a person who has got a stomachache is diagnosed completely wrong, anapatia panado, mwingine anaambiwa akatwe mguu na hakuna haja ya kumkata mguu because the diagnosis was wrong. And that is why I am so happy that you are working as a team in this hospital so that you can consult each other even as you treat the patients that come to you. I have no doubt that you will be very successful, and at this hospital we have become an example of how medical care should be provided. For us, and speaking of COVID-19, may I remind you all that we are still in the middle of the pandemic. And although we are hopeful that a vaccine will be with us soon, and I will be inviting Dr. Amoth to talk a little bit to that issue of vaccine, we must continue to take precautions to avoid contracting the disease. As Mama County has just said, each one of us now knows somebody who had COVID-19, who has passed on because of COVID-19, and therefore we must be extra vigilant as we move towards the Christmas period, the New Year period, remembering that our kids are going back to school in January. We have to be extra careful. But as I have repeatedly said, and we will continue to do so, it is the responsibility of each one of us to take a personal decision to protect yourself, and in doing so, protect your families and friends. The simple acts of wearing a mask, washing hands, and keeping social and physical distances can make a huge, huge difference in our lives. As we get into this festive season, let us not drop our guard, but instead be ever more on the alert and ensure that we do not become a statistic, whether a statistic of those dead or a statistic of those confirmed cases. And I know that sometimes the actions that we are taking are against our culture, are against our natural instincts. Many times you see somebody is so used to greeting hands that they give you their hand to greet. But there is one lesson we learned from the Akorinos, from the Akorino sector of our spiritual people. Akorino ni mone etebere, wathi kumugeithia eraga mundu iganira. Lego nawe wewe ina mask, wewe ina shati ya white. Ucio angekugeithia umwireke atia aiganire. Ti ati tutingenda kugeithania. Uguo niguo tuciaritwo na niguo tungienda. No kahinda-ini gaka mundu ni ake atia aiganire. Ladies and gentlemen, for us in the healthcare system, and this is where my friends at this hospital find themselves now, there is need to make concerted efforts and come up with effective and realistic ways of responding and mitigating against the effects of this ravaging pandemic. I'm glad to note yesterday, the courts have stopped the strike to allow for negotiations. And this is so welcome, especially during this festive season. I can confirm that my ministry and that of Labor and Social Protection and the Treasury and the Ministry of Public Service have continued to engage with leaders, the union officials, to find an amicable solution to the issues that concern our healthcare workers. But I urge at the same time that now that the courts have proposed that we continue to speak, I urge that each person resume their duties, continue to help wananchi, even as we speak and address all the issues that are there. I urge my fellow people in the Ministry of Health to please respond to the many pleas that we have made, that you resume the work at your stations all over the country. In many meetings with the Council of Governors, we have agreed that some of the issues that have been raised by the doctors and nurses and clinical workers are legitimate concerns that concern PPEs, and we have made sure there is not a single institution that will operate without PPEs, including where we are today. We are also addressing all matters related to the matters of insurance, beginning the 1st of October. That has been done. The counties that have not done so have made arrangements that the National Treasury to forward money directly to NHIF so that every health worker, and indeed every county and national civil servant, may be covered. Therefore, I urge you again and appeal to you to adhere to the courts, what the courts have held, and to adhere to your own hearts to come back so that we can help our people. Having said so, I think it is also important for me to be clear that under those circumstances, it is very important. There is always one of them. Under those circumstances, I would therefore like to urge those of you who may have been on strike to resume to avoid losing your jobs. Please do not lose your job. As we go towards Christmas, as we go towards the festive season, do not be the one statistic again who will be a job seeker next year. Let's not do so. Please go back to where you are supposed to be. And it is because we recognize that it is not enough to provide services, but the quality of healthcare also must be of an acceptable standard in order to meet the expectations of Kenyans. This is actually a constitutional requirement. As I encourage you all in the sector to remain steadfast in this service, I would like to urge the newly opened specialized hospital to establish and maintain those standards to be able to serve Kenyans better. As you are aware, the government of Kenya is currently implementing the Big Four agenda in order to fast-track the achievements of Vision 2030. And as I was alluded to by the Honorable Joshua Toro, discussing the issue of nutrition, food security, the issue of housing and healthcare coverages. As one of the many private sector providers in the healthcare sector, the ministry is going to rely on your knowledge and skills, among others, for effective rollout and delivery of the universal healthcare system. As I conclude, I once again wish to congratulate the directors of this facility for putting up and having the confidence to invest in the healthcare sector. I encourage many others to do so in many parts of this country. We are determined that healthcare will be shared equally between the public and private sectors. Before I leave, however, I would like to take this opportunity also to give you an update on the latest COVID-19 statistics in the country. Today, some 356 people have tested positive to the virus from a sample size of 5,768 in the last 24 hours. And ladies and gentlemen, these are 356 Kenyans. It's not something else. It's people like you and I. And I would also like to, unfortunately, record that we have lost 11 patients in our hospitals in the last 24 hours. But even as I say so, let me tell you, Kenyans, that God loves you. God loves our country. Yes, we have lost 11 people. And that is 11 too many people. But when you look at what is happening elsewhere in the world, you are left with grateful feelings for the Almighty. For example, in those 24 hours, India lost 338 people. The Italian nation, in spite of its advancement in medicine, lost 683 people. Here in Africa, down in South Africa, in those 24 hours, South Africa lost 184 people. In the last 24 hours alone, the United States of America has lost 3,293 people within a span of 24 hours. Those are more people than Kenya has lost since the beginning of this pandemic, since we have lost 1,629 people, including the 11 that we lost today. So when I say that God loves us, you can appreciate why I am saying so. We must be extra vigilant. We must be extra careful so that we do not lose any more people. But more importantly, we must not get into that space where we become so careless that the figures that are going out begin to read like those ones that are being read in Europe. My friends, I wish to record our sincere condolences to the families and friends of those who have lost their loved ones. Currently, I also want to ask the clergy and those who are spiritual in nature, like myself, to continue praying. I am, Dr. Bishop, when I said I'm spiritual, Bishop, I heard you laughing. I am actually spiritual. Because I want us to pray and keep in our prayers the 852 patients who are currently admitted in various health facilities countrywide, and those also who are in home-based isolation care. In fact, today, Bishop, we have got 49 patients who are in intensive care units, and we have another 37 patients who are separately on supplementary oxygen, and out of whom 29 are in general wards, while 8 are in the high dependency unit. Kwa hivyo, at this moment, I would like to therefore declare this institution, this hospital, officially opened. Vile vile, nikiongeza kidogo kwa Kiswahili, gwishira ndali ya ikugu ya kuigana, na dwaitu, aitura riri yitagwo gitura, gwishiragia ni kebi wa gitura, gwitagwo gitura ta kebi, no ni ndirerwo gwitagwo gitura, ndie kana ni guku gwitagwo gitura handu ha gitura, kana ni kebi witagwo gitura handu ha gitura. But either way, I'm happy to be here. Na ndakena muno ni gukorwo ndi guku muthi na gukena tondu andu aitura riri ni makugunika ni thibitari ino agenyi murateng'eragio Nairobi na riu no gukira bara mundu agoka guthondekwo. Kwa hivyo mkiona hospitali kama hii haikuja kwa njia rahisi. Hii ni kazi ya watu wamefanya sana. Diwani Mwaura na wengineo ambao walianza na familia yako, ambao walianza kujenga hii nyumba. I just want to congratulate you. Niseme shukrani kwa kila mtu hapa, kwa sababu haingekuwa kama hungefanya hii, kama ungejenga hii mjengo, hatugesaidika vile tungesaidika. Mswahili alisema mtakasha mvunguni shaiti yafanya nini? Shaiti ya iname. Na kweli hapa tunaona kazi ambayo inafaa, inakufaa, na Mungu atakubariki zaidi kwa sababu ya vile uligeuza. Badala ya kujenga supermarket, ikawa umejenga hospitali. Na sisi tungekuombea wewe ushikwe na ugonjwa wowote, na kwa sababu iko maternity, muongeze watoto wengi. Kwani mnafikiria maternity inatengenezewa nani? Si nyinyi watu wa area hii? Vijana muoe ndio hii maternity ipate kazi. Kwa sababu tunataka wa Kenya, na pia sasa hapa watu wa area hii mmepata maternity mzuri sana ya standards za juu zaidi. Kwa hivyo mimi vile vile ningewasihi wananchi wa area hii tusije tukapoteza mtu yoyote wakati wa Krismasi, wakati wa mwaka mpya. Tafadhalini tufuate ile masharti ambayo imetolewa na Wizara ya Afya. Tufuate zile kanuni ambazo tumeweka. Ndio nyinyi wenyewe watu wa area hii msije mkaumizwa. Mimi sitaki kusikia, hatutaki kama serikali kusikia ati kuna watu wa Keno ambao wameshika virusi wameangamizwa. Hatutaki kusikia ati COVID-19 imeenea kila pahali hapa, kwa sababu watu walipokuja Krismasi, walipokuwa wanasherehekea, wakati walikuwa wanakunywa kitu yao, na hiyo kitu nasema sana sana tungetaka iwe soda, sio hizo zingine. Hatutaki kusikia ati watu walipata hii virusi. Kwa hivyo jameni, mimi nikiwasihi tu na kuwaomba tuwe na Krismasi jema, muwe pia mbarikiwe katika mwaka ujao. Tunaomba Mungu ati mwaka wa 2021 iwe tofauti. Mwaka wa 2020 jameni, tumeona mengi. Tafadhalini bishops, clergy, watu wa makanisa, tuombee nchi yetu na dunia nzima kwa ujumla, ndio sisi mwaka ujao tuwe na mwaka mwema na tuwe na mwaka tofauti na ule tulikuwa naye mwaka huu wa 2020. Sana sana tuombee wale watu wote ambao wako hospitalini ndio wapate kupona, na Mungu abariki hawa na abariki familia zao. Na pia vile vile tuombee watoto wetu wakati wanajitayarisha kurudi shule mwaka ujao, ndio nao pia wasije wakarudi shule alafu waumbukizwe na hii virusi. Asanteni sana, na Mungu aendelee kubariki watu wa area hii, watu madirectors na wale wote wagonjwa watakaoingia hospitali hii kutimbiwa. Asanteni sana and God bless. Niwega muno andu aitu, Ngai arothi na mbere na kumurathima, arothi na mbere na kumwika wega, na thigũkũ ĩno mũkorwo na mahoya, na andũ arĩa matarĩ na kanyamu mateithio nĩ arĩa marĩ nako, because ithuĩ ũguo nĩguo tũtũraga. Wokorwo wĩna kĩndũ teithio ũrĩa ũngĩ, mũthenya ũmũthĩ nĩwe, rũciũ nake no gagũteithia. Nĩ wega mũno, Ngai arothi na mbere na kumurathima. Thank you very much. Sasa
COVID-19 ni janga la ulimwengu linalosambaa kutoka kwa mtu mmoja hadi mwingine. Mtu yeyote anaweza kuupata kwani haubagui. Kwa hivyo, usibague wale wanaoupata. Wacha tuchukue jukumu letu katika kukomesha unyanyapaa kwa kufuata